Hey, welcome to Chapter 4, Aminoglycosides 1. Sure, I'll do another video about aminoglycosides. But I just want to introduce the drugs themselves. Amikacin, which is brand Amikin, gentamicin, which is garamicin, Neomycin, as part of Neosporin, but also as part of some other combination drugs, usually for topical things. And then Tobramycin, Toby, or Tobrex. So common to the class, since we're using drugs that are all in the same class, is ototoxicity, nephrotoxicity, and with that nephrotoxicity we need to reduce dose based on renal function. Note, however, that we have 3 different stems in the same drug class. So casein is maybe the exception, but the mycin, MICIN, and the mycin, MYCIN, you can't use these for identifying the drug class that the particular antibiotic belongs to. So let's do our practice question. Providers worried about aminoglycoside resistance, which would be the best to provide the patient. Select all that apply. And when we're talking about these, the first things that come to mind with amikacin is that it does have the least resistance. Gentamicin is relatively cheap. Neomycin, it's the most toxic, so we only really see topical forms. And then Tobramycin has an inhalable form, which is a little bit unusual. They're working on getting amikacin in an inhalable form. There's like a liposomal form that they're working on, but I haven't seen that it's come out yet. And then, of course, amikacin has the least resistance. And let me convert it to the drug names. So we'll go to question 2, the 4 drug names: amikacin, gentamicin, neomycin, tobramycin. And the way that I remember that amikacin has the least issues with the resistance, or even works against multi-drug resistance, is that the word ami, so you think like mon ami, my friend in French, is your friend. So I think, well, if I had multi-drug resistant organism, then amikacin would sure as heck be my friend. But that's how I would remember it. Okay. Let's go to practice question number 3. Let's make B correct. An elderly patient has kidney dysfunction as demonstrated by poor urine output and creatinine clearance. And creatinine clearance is a way of measuring the GFR, the glomerular filtration rate. Which medication would need a dosage reduction because of nephrotoxicity? And the answer is all 4, sort of. Neomycin doesn't really have any parenteral forms, so you wouldn't really have this issue, but it's because it was so nephrotoxic that you only see topical forms. The way that I remember nephrotoxicity and ototoxicity to the class, because I can put all 4 of these in my head. As soon as I hear neomycin, I immediately think of its friends, amikacin, gentamicin, tobramycin. The first 2 letters in neomycin are Ne for nephrotoxic. The next letter is O for ototoxic. But that's how I remember those 2 are part of the class, those 2 toxicities. Let's again make C correct. So which aminoglycoside is so nephrotoxic and so ototoxic that it only comes in topical forms? And again, neomycin, if it were to have IV forms, it would be terribly nephrotoxic and ototoxic. So we only see the topical forms. And a lot of times we see them in combination. Neosporin is probably the best answer, or best example, where you have Neosporin that has neomycin, polymyxin B, and bacitracin. Okay. And then let's make D correct. Which aminoglycoside has an inhalable form for cystic fibrosis? And interestingly enough, Tobramycin has this Toby inhalation solution, or Toby podhaler. And the way that I remember that is that there's a BR in Tobramycin, so I think of BR as the first 2 letters to breathe for Tobramycin. And then question number 6, we'll make D correct, but select all that apply. A patient complains of ringing in the ears. Which medication could have caused this? And I put that all 4 could have. Again, that's tinnitus, or ototoxicity is part of what this class does as its adverse effect. And I did put that neomycin would cause that if it had a parenteral form. But amikacin, gentamicin, neomycin, tobramycin all can cause this ototoxicity. So just to review real quick, amikacin, this is the one with the least resistance, and they are working on an inhalable form, but I don't know that it's out now. Gentamicin, again, this is one of the cheapest ones. I think of Gent Cent, so 1 penny, as being relatively inexpensive. But when we talk about, as a class, it's going to have the ototoxicity, it's going to have the nephrotoxicity. Neomycin special because really it's so toxic that we have to use topical forms, and to use that Ne and O to remember nephrotoxic and ototoxic. And then Tobramycin, remember the BR for breathe, because it has that inhalable form for cystic fibrosis. Now, with all these toxicities, maybe you have children and you remember getting gentamicin or tobramycin for the child's eyes, for pink eye. There's very little systemic absorption when you have these drugs when you use them topically. So gentamicin, tobramycin, perfectly safe to use with a child when you're using it for pink eye or conjunctivitis.